So, I'm going to be discussing musculoskeletal injuries that occur in soccer. I attended an LAFC game this past Saturday. Los Angeles Football Club, it's the newest professional sports team in Los Angeles. They are a member of the Major League Soccer. And this is for Kinesiology 353. So, here in the first slide, we'll talk about musculoskeletal injuries that occur during soccer. And a few facts about soccer: it's the most widely played sport in the world, and there are a lot of proven health benefits to playing soccer. And there is a lot of areas of the world that can't afford other sports to play. So soccer has become a very good outlet for activity and for exercise and helps fight cardiovascular disease. But along with any contact sport, there are still injuries that occur while playing. And injuries most frequently happen at the professional level, and as levels go down to amateur, they happen less, and then recreationally, they happen even less, and that's due to the pace of the game and skill of the players. So the first injury I'm going to talk about is the most common type of injury in soccer, and it's muscle or tendon strain. It's the most common occurrence in soccer for an injury. The most common location of muscle strains happen in the lower body, lower limbs, for example, hip, groin, thigh, knee, lower leg, ankle, foot, and toes, which makes sense because most of soccer is played with the lower body. There is upper body contact, but most of the contact is done with the feet and legs. A strain is an overstretch or a tear of muscles, tendons, or both at the same time. And there are three grades of a strain. And over to the right, we can see in the picture, there's a demonstration or example, of hamstring strain levels. And the reason I put hamstring here is because it's the most common location of a strain for soccer players. And we see grade 1 is an overextension of the muscle and or tendon, and sometimes slight tearing. Grade 2, there'll be a partial muscular tear that usually takes 4 to 8 weeks to heal, 4 to 8 weeks. And grade 3 is a complete tear of the tendon or the muscle, which can be incredibly painful. So now we'll talk about the mechanism of injury. Hamstring strain is one of the most common strains in soccer. Also, the quadriceps strain is one of the most common strains in soccer, and they're kind of a reverse movement of each other. There are many types of MOIs, also known as mechanism of injuries, that can occur and cause strains while playing soccer. A common mechanism of injury that will lead to hamstring strains is a non-contact extensive hip flexion with an extended knee, and that's important to remember, the hip flexion and extended knee, because that generally happens when somebody has their leg on the ground planted and they're going into a full sprint motion and you overstretch or tear part of the muscle. And that happens especially if someone's not warmed up properly or somebody is over exerting themselves. Another common location for strain is the calf muscle and other muscles in the lower leg. And that's pretty obvious because of the location and how much pressure is put on the lower leg during sprinting motions and running, and also lateral movement. The calf strains frequently happen during quick sudden sprints or a motion that puts pressure on the calf. Another example would be jumping and landing. You do a lot of header balls in soccer, and there's actually a lot more jumping than you would expect. It generally occurs when there's too much dorsiflexion. So when the toes are being pointed too high up, that's a sign or a potential cause for a strain in the calf. So assessments that you'd want to do for strains are similar to that of sprains. You want to see what kind of pain they're feeling. Is it a sudden sharp pain? Is it a pain that's progressively getting worse? Is it slightly improving? What did it feel like at the time of the injury? So you can kind of rule out if there's potentially a broken bone, or if you think that they didn't dislocate something. Not that you can necessarily always tell, but getting an idea of what the pain feels like can help with that. and then seeing if they're able to walk, if there's swelling, and if there is swelling, how much swelling. Does it hurt when trying to bend the joint and location of the injury? For example, you would, if they were able to, want to test out bending the hip joint and the knee joint and see what's painful and which direction is causing pain. Because the direction which is causing pain can be an indication of whether it's a muscle on the front or the back of the limb. So now we're going to talk about the second most common musculoskeletal injury in soccer, which is a sprain. And sprains occur in the joint and the ligaments. And we're going to talk about ankle sprains because they're extremely common. And they're not only extremely common in soccer, but also in pretty much every sport. A sprain is an overstretching or tearing of a joint or a ligament. And there are 3 grades of sprains, just like there are 3 grades of strains. And in the diagram to the right, we can see grade 1 is overstretching, and you can see some tenderness and some actual internal bleeding on the ankle. And grade 2 is a partial tear. Grade 3 is a full, complete tear. And that is very similar to a strain. So now we're talking about the MOI of an inverted ankle sprain. There's a photograph of what an inverted ankle sprain would look like. And there are 2 types of ankle sprains, inverted and everted. And inversion is the most common, not only in soccer, but in general for all sports. Inverted ankle sprain during soccer most commonly happens when landing incorrectly during a forward movement or a lateral movement. Inverted ankle sprains are common during both contact and non-contact plays. Many times a player will step wrong or step to the left or to the right and put too much pressure on their ankle, and their foot will not support their body, and then their ankle takes the grunt of the weight. And an inversion of the ankle occurs, an inversion sprain of the ankle occurs when the foot turns medially toward the body. And that's important to remember which direction. And now we'll talk about an eversion ankle sprain, which is the same joint, same type of injury, but happens in the opposite direction. It's less common than inversion. Eversion ankle sprains can happen without contact, but a lot of times they will happen when there's actually contact made to the ankle, because it is easier, because of the anatomy of the body, to have an inverted ankle sprain. Eversion a lot of time is due to force. For example, you can see in the photograph that there is another player's foot pressing on the outside of the leg, and it's causing the foot to turn laterally away from the body and cause an inverted sprain. So although the foot is turning away, the ankle is turning inward. So the assessment testing methods for ankle sprains are very similar to strains because they are a very similar injury. And you would want to ask if they can put pressure on the joint, see if they can stand up and walk. You don't want to put them in a position of re-injuring the ankle. So if it's somebody that you think, if you can tell by how severe it looks, you might want to help them up and get some kind of medical attention or assistance to get off the field. If they can walk, see if they can walk without limping, how much they are limping. And then if they can run it off, most likely it was a grade 1 sprain or just a slight tweaking of the ankle and maybe not even a full sprain. And then you want to also look how swollen the ankle is and how quickly it's become swollen, because if it became swollen very quickly and it's a large amount of swelling, you can have a pretty good idea that it's most likely at least a grade 2, maybe a grade 1, but a somewhat severe grade 1. And that'll give you an idea of how they have to be assisted, what kind of treatment they're going to need, and if they're done for the day or for the rest of the game. You also want to assess which direction the ankle turned, and that refers to being able to diagnose or see if it was an inversion or an eversion sprain. So next, I want to talk about fracture. That's another common injury in soccer. It's a lot less common than sprains and strains, but it is still somewhat common. And the most common fracture that happens during soccer is a clavicle fracture, also known as the collarbone. Fractures are not as common as strains, but they do happen. And they happen because of the fast and high intensity of the sport of soccer. So when you get run over by another player or you fall, you are falling at a pretty quick rate, even though soccer is not seen as being a high contact sport. there is definitely high contact involved. And a fracture occurs when there's too much pressure put on the bone or the joint connected to the bone, resulting in a crack, break, or a snap of the bone. And let's discuss the MOI of a clavicle fracture briefly. It's the most common break in soccer, as I said before. And collarbone breaks are usually caused by contact from another player or landing on the ground incorrectly. So it's not something like a sprain where you're going to twist something the wrong way. You're going to have some kind of pressure, either pressing on the bone itself or pressing on the connecting joint. And clavicle fractures commonly happen when too much pressure is applied to the upper torso area. And this is important when the shoulder is overly flexed, and sometimes also when there's too much internal rotation that can put pressure on the clavicle, and that can cause the break. And in terms of assessment of the clavicle, or any other fracture for that matter, if you can tell that there's a break, for example, a compound fracture where the bone is penetrated through the skin, you want to get medical attention as quickly as possible, and you'd want to get the attention of the doctor to come on, because that's not something as an athletic trainer that you are able to pop back in place or fix. That's something that needs to be, is considered an emergency. And here are my references. And that will conclude my musculoskeletal presentation for 3 common injuries in soccer.